Well, in this video, we're going to run you through what the indicators on the side of a urine ketone test strip relate to, and the significance of these levels when you are dieting. And principally, this advice is intended for people that are doing low calorie, low carb, high protein, moderate fat diets, not necessarily ketosis diets, but Atkins and those similar type of weight loss regimes where you're trying to reduce your carb dependency and increase the breakdown of fats, resulting in ketones in the urine. Now, on the majority of urine ketone test strips, you will see guidance given in terms of the color density on the test strip once you've dipped it, and the guides that tend to be on there are signified as a trace, small, moderate or large amount of ketones. Now, we're going to talk to you about what that means in terms of the levels and a little bit more about those levels, because depending on where you are in the world and viewing this video, you will have one of two scales going on for the ketones. And the North American scale is in milligrams per deciliter, and the European and UK scale is in millimoles per litre. So a little confusion can creep in then if you see these two different scales. It's pretty easy to convert from one to another. But on this particular pack that we're showing you here, you will see just below the levels where they've got the guidance, you will see under a trace 0.5, small 1.5, moderate 4, and a large is over 8, and the scale, if you rotate the vial around, you'll see is in the European millimoles per litre. Now, you've got to remember these guidance and ranges are put there really for when these test strips are being used for the detection of ketoacidosis in diabetics that are having diabetic crisis. The significance of these levels is more for those clinical uses, and there's no packs that have been modified or set up or labelled specifically for guidance for dieters. So you have to interpret your significance of the ketone levels and what you're going to get in relationship to these results. Now, on the back pad here, you'll see a dry negative result test strip, and that relates to a negative pad colour, which indicates for the majority of healthy people that aren't breaking down fats into ketone bodies, it is normal for you to have only negative or at very most a trace of ketones detectable in your urine at any one time. The majority of a 24-hour period, if you're eating a normal healthy Western diet, even if you are on a calorie limited diet, if you're not breaking significant ketones, the level of ketones in your urine is going to be either negative or at most a trace. So if you are getting over a trace of ketones, either a small, moderate, or if you're starting aggressively on a diet and breaking down an awful lot of fats into ketones, then what you would expect to see within the first couple of days is large amounts of ketones detectable in your urine for the majority of the day. If you suddenly switch to breaking down carbs, if you break your diet and go back onto carbs, the ketone level in your urine, obviously there is a lag between what's going on in your blood and what's coming out in your urine, because your urine is stored in the bladder. Can be anything up to 8 or 12 hours depending on how much urine you're producing and how dilute the urine is. But you would expect to see it to start reducing over a period of time, and then it can switch off completely and go negative for a period. But what we'd normally expect to see somebody starting a diet regime is initially there'd be quite a surge in the ketones detectable in the urine, and you would get either moderate or large amounts of ketones detected on a regular basis. And then over a period of several weeks to sometimes shorter, several days, as the liver starts to increase the amount of enzymes that transfer those ketone bodies back into the energy producing ketone bodies, you'd see a reduction. So even if you were really strict with your diet and really putting yourself into a ketogenic state, you would still expect to see a reduction in the levels of ketones you were detecting with the ketone sticks in your urine. So after several days or weeks, you would drop down from large to moderate even to a small amount of ketones, and that would be perfectly normal. It just indicates that your liver enzymes have increased and are converting the urinary ketone bodies back into the energy ketone bodies, so less are coming out in the urine, because it's basically the body's becoming more efficient at converting the ketone bodies into the energy source required. So that's how you interpret the results. It's very easy to just get a colour match. All the test strips, when you take them out, should be of a negative colour match initially, even when dipped in urine. The other thing just to say is the read time. You'll see on this pack, which is the Wangcheng URS 1K brand, the read time for the match when you compare the colour and read your result is 40 seconds. Some brands are 30 seconds, some brands go up to 60 seconds, but it's important that you do the match at the read time specified on the product that you've bought, and you don't interpret it later on, because you can get further colour changes on the pad over time. So the correct result is the read time at the 40 seconds on this brand, or whatever your product brand is. Okay.